Welcome to Spotlight, Congressman Jim McDermott. Thanks for joining us. Why is the issue of poverty so important to you?
Well, I think if you believe that this country should have social justice, then you have to have a measure of how well people are doing in this society. Economic justice has to be measured some way. And we've had a measure in place since the 1960s that was based on somebody going to the grocery store and saying, how much does it cost to feed a family of three? And they figured out what that was, and then they multiplied it by 3, and they said, that's the poverty level. Well, that clearly is not the situation today. So that's why we're interested in changing it and making it more contemporary with what the actual society is that we live in. Otherwise, how do you make a judgment about who's poor and who isn't? Who needs a program to help them make this or that? I mean, it's the benchmark that people use for saying, well, we're going to put more money into this school because they have more children in poverty, or we have people who are ill and we need a Medicaid system or whatever. So it is a fundamental benchmark that you need in a society to make a judgment on what kind of programs you're going to put together.
You've introduced legislation to help Americans struggling at or near poverty, such as extending unemployment insurance and controlling health care costs. What are the prospects of these bills passing?
Well, I think, first of all, changing the poverty standard is not necessarily going to change who's eligible for the programs. That has to be decided as a second step later on. I think there are clearly issues of social justice or economic justice, if you will, that need to be dealt with. That is our ability to have access to health care that's affordable, that people ought to have housing, that people ought to have food. I mean, all of these issues of basic survival in a society. We have not updated the standards. We've not updated the amount of money we put into it for a very long time. So we are behind the 8 ball, and I think we really need to move forward on these issues.
As a doctor, a psychiatrist, you've traveled all around the world in some of the most impoverished countries. What has it taught you about poverty and how it can be ended, especially here in America?
Well, I think that there is no simple way to do it. But you do have to give people the basics, make sure that everybody has got the basics if you're going to allow them then to have the time and energy to lift themselves further into the society. If people are worried about whether they're going to have a place to sleep tonight, or if they're worried about whether they're going to have any food for tonight, or if they're going to be able to feed their children, or their child is sick and where do I take them to get their problem taken care of, if those are the things they're worrying about, then you're never going to get them out of poverty because they're just too absorbed in survival. And I really think that once we get people to a survival level, then we can begin to lift, we can then talk about education. Because people will then have, if you're working 3 jobs to survive, you haven't got any time to go to community college or get yourself an additional skill or whatever it takes to move up the ladder of economic success in this country.
Do you think ending poverty is a real goal of the Obama administration?
Yes. He has some tax relief for people at the bottom, which I think will in the long run have a positive effect. The budget that we're passing today is one that we're going to authorize the reduction in taxes on people at the bottom, which in the long run is going to have an effect on people on the bottom.